Melanoma, risk factors and prevention. When caught early, melanoma can be highly curable. So it's important to practice safe sun habits and know the risk factors and prevention methods for melanoma. What is a risk factor? There are some factors that may increase your chance of developing cancer, and although risk factors can influence the development of cancer, most do not directly cause cancer. Some people with several risk factors never develop cancer, while others with no known risk factors do. So knowing your risk factors and talking about them with your doctor may help you make more informed lifestyle and healthcare choices. Some risk factors that may raise the risk of developing melanoma include sun exposure to ultraviolet rays plays a major role in the development of skin cancer, along with exposure to ultraviolet B, UVB rays. People who use tanning beds or sun lamps for indoor tanning have an increased risk of developing all types of skin cancer. So using indoor tanning devices is strongly discouraged. People with many moles or unusual moles and fair complexion tend to burn easily, have blonde or red hair, blue eyes, and freckles are at an increased risk for developing melanoma. If you have a close relative, such as a parent, brother, sister, or child who has been diagnosed with melanoma, your individual risk of developing melanoma is 2 to 3 times higher than the average risk. About 10% of people with melanoma also have a family history of the disease. Therefore, it is recommended that close relatives of a person with melanoma share their family history of the disease with their doctor and routinely have their skin examined by a dermatologist. Other examples of risk factors that may raise the risk of developing melanoma include people who have already had melanoma have an increased risk of developing other new melanoma, age, and if you have a weakened immune system or use certain medications that suppress immune function, you will tend to have a higher risk of developing skin cancer, including melanoma. Please discuss your risk factors with your doctor or dermatologist, and if you notice any suspicious moles or lesions on your skin. Prevention. You should always practice sun-safe habits by wearing sunscreen and reapplying if you are outside more than 2 hours and after swimming, sweating, and toweling off. Wearing sunglasses and long-sleeved shirts and long pants and skirts to cover your skin from the sun and staying under shade, umbrella, tree, or other shelters will reduce exposure.